Hey everybody, this is Dr. Stott at Smile Now Dentures Implants. Every single month I am looking on the internet to see what's going on with everybody with their implant experiences because I, just like you, would like to see what people's experiences are and see what kind of questions are out there. And so this month I collected some of those questions and I wanted to answer them here on this segment with you. Got my prototype for finals and I notice I whistle a lot when I say the words with an S or an SH. Anybody else have this and how do you fix it? It's driving me crazy. So these are called phonetics. There's a lot of things that work in harmony for the different types of sounds that we make when we talk. S is one of the harder ones to do, like THs, S's, V's, R's. These are all really important. And it's really determined on the position of the tongue and the position of the teeth when it touches. So if somebody is slurring their words or lisping or having S sounds, can't really say Mississippi or count from 60 to 66, if you can't do that correctly, then probably where your teeth touch is not in the right place, and you probably need to reduce the amount of material that you have on your teeth so that there's more space and you can close them a little bit more so that your tongue can be in the right place when you're speaking. This is something that when you go through the process and have prototypes, we assess. We think prototypes are a super important part of the process of getting the teeth that you want at the very end of your journey. What we can do with prototypes is we can measure this, we can have you speak with them, we have you practice at home. Doing the 2 weeks and prototypes at a minimum is a huge advantage to you so that you can figure out exactly what's going on with your teeth, how to fix it, and make sure they're the ones that you love. So I'm glad that this poster was in prototypes because they're going to have that time to try to fix this. My mother received this dental prosthesis with implants for 17,000 pounds. When she smiles, the screws or implant connectors are clearly visible from the outside, which is very distressing for her. And my question is this normal because there's no other way to construct it, or is this the result of work by a dentist at the beginning of their career? Thank you very much for answering this question. So the first thing that I would notice about this picture is I would compare the price. So 17,000 pounds, I don't know how much that is off the top of my head, but it's about $20,000. What I would expect for $20,000 is, 4 to 6 implants, probably is going to include sedation. It's going to be something made out of a really good final material, either titanium or monolithic zirconia. So that's what I would expect. That's what I do in my practice, is even actually a little bit lower than that. So when I look at this picture, what I'm seeing is I'm seeing a set of teeth that are made out of acrylic. So that's what dentures are typically made out of. I see connectors that are associated with snap-on dentures. Now these worked really well for years and years and years. Is today this the best option, especially for that amount of money? Maybe not. She does have a top and bottom here, so if she paid a full $20,000 to get both the top and bottom done with 4 implants on each one, yeah, I'd actually say that's a little bit less than what the average dentist might charge. But what we are seeing is we do see some color coming through the acrylic. Acrylic is a material that's translucent. That means that the colors from the implants or the housings, something like that, might be coming through. These also might just be kind of darker marks on the teeth from something else, and I'm not really sure what that might be. So yeah, it's hard to judge what this is. However, is it normal for someone that when they smile, they can see the underlying implants or the material through it? Usually no, unless you're like lifting your lip up a lot. And is this done by like a new dentist? Like we don't know that for sure. Young and old, there's a lot of dentists that are doing treatments and maybe they don't have as much experience as they should. Or you're going to somebody because cost is such a big, important part of your decision-making process, but what that results in is cutting corners. And by cutting corners, you're gonna get a result that might be less than optimal. And I do understand and respect like budgetary concerns. I know it's important. I just personally know that it costs me a certain amount to do the work that I do. I cannot do it for less than what it costs me to do the quality of work that I want to do. And so when you compromise, like also the dentists also have to compromise. Not really sure, but it is a bummer. And I definitely, looking at the picture, know that probably something could be made better. Like something better could be made for this type of patient. It's hard to be a patient and there's so much information out there. And I see people getting information all the time on forums or Facebook groups just like this that I don't necessarily agree with, having placed 10,000 implants. And so this is designed to help you understand the dynamics of implant dentistry, what tooth replacement options look like, and how to get them done. And if you have any specific questions that you would like me to cover in a future video, I would love it if you just like comment or post down below. Say thank you. I appreciate that a lot. And until next time, this is Caleb Stott from Smile Now Dentures Implants, and I will see you later.